Hey, Ariel. We're going to get started in about 1 minute here.
Great.
All right, let's go ahead and get started. So, thanks everyone for joining. Uh, really appreciate, having this group of healthcare professionals from all around the world. We've got people from Africa online. We've got people from the Middle East, the United States, Asia, all around the world. And, it's really humbling every time we do these webinars and we get to see how many people are interested in doing this volunteering and global health work. We had more than 350 people register for this event, so it's really cool. We're going to start doing these monthly webinars from here on out. It'll be a combination of H1 Connect giving you an update on the different opportunities we're working on, things that we're doing to grow the network. And then we're also going to bring on guests like Rebecca Weintraub today, who can teach you a little bit more about the different opportunities that are out there, growing your career in global health, training for medical missions, and all that. So it'll always be a combination of an update and then some sort of educational component, so you can grow as future volunteers. So if you can go to the next slide, Katie.
Yep.
All right, so agenda for today, we're going to do some quick introductions to the panelists in the call here. I'm going to give a quick overview of H1 Connect for those of you who are new to the network, and I'm going to share some new initiatives that we have going on to help provide more value to you. And then we're going to interview Dr. Rebecca Weintraub. Rebecca Weintraub is the director of the Global Health Delivery Project at Harvard. So Katie's going to do that interview, and then we're going to open it up for anybody that has questions. If you have questions throughout, feel free to use the Q&A function. Just click on the bottom where it says Q&A. You can add any questions in there, and then Katie and I will try to answer as best we can. Feel free to raise your hand when we get to the Q&A at the end, and we'll try to bring some people on live as well. Okay, next slide, Katie.
Yeah.
All right, so let's start with introducing the team. So I'm Miles Kirwin. I'm the Chief of Staff for H1 and then running the H1 Connect team here. Rebecca Weintraub, who we'll introduce later, is our medical lead. And then we have Brielle and Katie, who are in charge of engaging the network, supporting the network. A lot of times, if you email volunteer@h1.co, you'll get Brielle. And then you'll see Katie in the WhatsApp group sending email updates and all that, and generally engaging with you guys. So if you have any questions, Katie and Brielle are your go-to. And then I want to introduce Ariel Katz, our CEO and founder. Ariel, you want to introduce yourself?
Yeah. Hey, everyone. Thank you for joining and really excited that you're a part of the H1 Connect network. We hope to continue to offer value and services now around volunteering and helping with medical aid missions around the world. And Rebecca's going to share more about what we're thinking about to further help in your careers. And just thank you for being a part of the network. It means a lot to us, and we're here to serve you guys.
Great. Okay, you want to go to the next slide? Katie? So I want to give a quick overview of H1. I'm not sure many people have seen this slide before, but this is the slide that we generally share with our NGO partners like Save the Children and all that to describe what H1 is. So H1's mission is to connect the world to the right doctors. And we really have two sides of our business. On the right side is the one that you are all familiar with. That's connecting doctors in our network to NGOs for volunteering, medical deployments, things like that. On the left side is another part of our business that really funds everything we're doing here, which is connecting doctors with pharma companies, life sciences companies for research, clinical trials, all that. We have two ways we engage with doctors. We maintain a database of doctors that we pull from public registries, from hospital websites, things that we can find from the web. And there we have about 10 million doctor profiles. And then we have our network of doctors, which all you are a part of, which is now over 4,000. So that's just kind of an overview of what H1 is, and just wanted to kind of give you guys some context around what we're doing. Today, we're focusing a lot on the right and connecting you with volunteer opportunities, but we see a world where we're going to start connecting doctors like yourself who want to engage with industry and pharma for research and clinical trials. So if you go to the next slide, I'll kind of give an overview of that a little bit more. So H1 Connect's mission is to build global health equity. We started on the bottom right over here back in October when the war kicked off in Gaza. We started with conflict response, and we wanted to reach out to as many healthcare professionals as we can to see who was interested in volunteering and helping out in Israel at first, and then Gaza ever since then. And since then, we've expanded to, we've built these relationships with International Medical Corps, Save the Children, Team Rubicon, Project Hope, and we're starting to help them out with humanitarian response overall. So that far right vertical over there. So that includes not only conflict response like Gaza in the war zones like Ukraine, but it can also include disaster response like an earthquake in Haiti or different opportunities like that for medical deployments. But we're considering all of this under an overall umbrella of global health because what we've noticed with H1 is we've seen in the world this inequity of healthcare. We know what's going on in Gaza. We see all the children and everybody who's struggling there. But there's places all around the world where there's just not everybody has the same access to healthcare as those in the United States and elsewhere around the world. And we want to fix that. And these are really the main initiatives that we're trying to do that with and through the network that we have here with you guys. So like I said, we've started with humanitarian response, but we want to do work with global development, capacity building, training in healthcare systems around the world, disease control, going out and doing deployments for vaccine initiatives, things like that. And then the far left, like I mentioned before, global health research and engaging with pharmaceutical companies and different life sciences organizations who want to work with you on clinical trials or work with you on educating on their latest drugs and different surveys and just engagement in global health research overall. So we can identify where those inequities are and we can provide resources there. So that's kind of H1 Connect in a nutshell. We're trying to build this community of healthcare professionals who want to build global health equity. But we're going to focus today mainly on the right, the humanitarian response piece. So I'm going to speak a little bit more on what we've learned from working with all these NGOs and the World Health Organization. So if you go to the next slide, Katie. So in February, I traveled to Egypt, to Cairo, to meet up with a few NGOs, meet with a few doctors. Some of you might be on the call today. And I also met with the World Health Organization to just understand what they're looking for in healthcare professionals who are volunteering for these medical deployments. And what I found is that the World Health Organization established this program called the Emergency Medical Team Program. It was established after Haiti when they realized that there was all these doctors that were super eager and they wanted to go deploy and they wanted to help, and they kind of showed up in Haiti. There wasn't like a standard of care. There wasn't like a system in place to kind of govern everything. So what the World Health Organization established is all these NGOs setting up emergency medical teams beforehand through these ready reserve rosters, which we've talked about a little bit in the WhatsApp and the email, but I just want to dive in a little bit deeper here. So what we found and what the World Health Organization told us is that they want their NGOs to have these large reserve rosters in place before disasters strike or before conflicts start up. So you as a doctor would join the Save the Children Ready Reserve or the Team Rubicon Ready Reserve or the Project Hope. You would engage with them, join their roster. They would probably do monthly webinars similar to what we're doing. They would have your information. And then when a crisis pops off, you would be the first one that they call. And they need large rosters to make this happen because, you never know when a disaster will strike, and you need to make sure that you have somebody available on call who can answer. So what they recommend is at least 5 healthcare professionals for every one position, if you really want to be able to deploy rapidly. But what we found moving to the middle box here is these NGOs have a hard time finding doctors. They rely on old rosters, word of mouth, and, there's not really a system in place to connect healthcare professionals who want to do that work to NGOs. And on the other side, there's also not really a centralized place for people like you who want to do this work, who want to do medical deployments and volunteer, to find opportunities with NGOs. And that's kind of where H1s has come in. So we're trying to be that bridge of connecting doctors who want to do this work with NGOs who need help and who need the healthcare professionals on their rosters to be ready to deploy for disaster, or conflict response, or those other buckets that I showed on the previous slide on capacity building, training health systems, disease control, just different initiatives to improve global health. So if you go to the next slide, Katie, I want to talk a little bit more about the reserve roster piece. So when we started H1, we were focused on, we're going to place you on a mission, or we're going to place you on a deployment around the world. And we're still doing some of that today, especially for Gaza. But since I had that conversation with the World Health Organization, we've learned a little bit more about what these NGOs are looking for. We're now shifting a lot of our focus to, we want to place you on reserve rosters with multiple NGOs. So you could be in the H1 network, and you could be on the Save the Children roster. You could be on the Team Rubicon roster, the IMC roster. And what that provides is, on the left over here, more deployment opportunities. So if you're a very qualified healthcare professional, you're really interested in doing volunteering global health work, I'd encourage you to apply to each of these rosters, sit on all those rosters as in a reserve component. There's no time commitment. It's all optional. And even when you get the call, it's still optional, but you're going to be the first one who's called for these missions. So if you want to deploy on all these opportunities and do this kind of work, you need to be on these reserve rosters. And then on these reserve rosters, you're also going to have access to training, exclusive training opportunities that you wouldn't get otherwise. Because you're going to be, the priority for these NGOs for who they call on for future missions. They want to make sure that you're trained and ready to go. And then the far right here, you're going to be pre-qualified to deploy as soon as possible. So for those of you who, if there's anyone on the call who was selected for a mission in Gaza, you know that there's a lot of qualification that comes into play. They need to get your passport. They need to get your medical license. They need to, give you some sort of training, standard of care information. We want to knock all that out beforehand in the reserve roster before you deploy to a conflict zone or a disaster zone or something like that. So you'll have more deployment opportunities. You'll have access to training, access to these NGOs that nobody else has, and you'll be pre-qualified so you can be ready to go for a mission. So expect to see a lot more of these applications come out for reserve rosters from Katie and I in the future. Next slide, Katie. So this is really what we're trying to build. Think of H1 as your platform and connector to all these different organizations, to all these other opportunities. So what we're showing here is we're going around to all these NGOs and we're saying, work with H1, share your roster with us, and then we will in turn create this global roster that you can pull from healthcare professionals to bring over to your roster. So you, as I mentioned, as a healthcare professional, you're sitting in the center here with H1, and you can access all these different NGOs and be on all their rosters. And you'll notice that some people who are in our group are already on some of the rosters. Like there's many people who are probably on this call that are on the Save the Children roster. And we're starting to get more and more from these different rosters joining H1, sharing their experiences, giving their best practices, and sharing their story. And it's just improving our network overall. So that's what we're trying to build here, this global network of doctors who want to do this work, want to engage with these groups. And while right here we have NGOs who are mainly focused on humanitarian response, development, capacity building, we also have relationships with life sciences companies, healthcare organizations all around the world. So think of H1 as your connector, your platform to connect with different organizations outside your home country. We're not a job placement organization. I wouldn't think of H1 as your recruiting partner to help you find a job in the United States or a job like in a hospital. But we can really help with that extracurricular component. So if you want to do volunteering, if you want to do global health development, if you want to do research, think of H1 as your partner for that. Next slide. So just to hit on this a little bit more, what does H1 provide? On that previous slide, we talked about the network and the huge globe of what we're trying to build. And in order to do that, what we previously described, we need to have as many healthcare professionals in our network as possible. And we need your help to grow that. And this is the value that we're trying to provide. And this is the value that you can share with your colleagues to help them join the H1 network. The first thing is think of H1 as a way for you to build your global health reputation. You can message in our WhatsApp group. You can build your CV, your resume. You can build it one time, and then we're sharing it with all these NGOs. So you've probably heard us mention multiple times, complete your H1 profile, build your H1 profile. There's a lot of information there, and that's all the information that our NGOs require. So by completing that profile, I'm sharing it with all these different partners and kind of being your partner to help you engage with these different groups. We're aggregating all those volunteer opportunities, both for the ready reserves and specific deployments that we hear about. We're in the future going to help you engage with industry for research. So H1's fortunate to have relationships with all the top pharma companies, Johnson & Johnson, Pfizer, AstraZeneca, all these different groups. We have relationships with them because we help them find doctors for clinical trials. And we want to help you with that and help you engage with these different organizations for, they always need surveys for different global health research they're doing or potentially clinical trials. And then lastly, we want you to collaborate with each other in the WhatsApp community we've made. And you can create different groups in there. You can connect with each other on different topics related to global health or, whatever's on your mind. So this is just an overview of, what H1 is and what we offer to our healthcare professionals today. And like I said, we can use your help in growing the network and, it benefits you. The more the network grows, the more NGOs we can partner with and the more opportunities that are available to you. Next slide. And we've been really successful so far. So like I mentioned on one of the earlier slides, we've got 4,000 plus doctors who are in our network now. When I say doctors, I mean, they could be nurses, PAs, healthcare professionals overall. We've got more than 1,000 in our WhatsApp group, and it's been working. We've had NGOs that have taken a lot of our doctors. We have one here on the right, Modathur. We've introduced more than 60. We've made connections with more than 60 doctors and NGOs, and we've placed more than 20 on actual medical rosters for mostly deployments to Gaza, but also some of the reserve rosters. And then the bottom here, this is an example of some of the groups that we've worked with. So the network's working. It's super exciting for us. Katie, Rebecca, Ariel, and I are really excited about engaging with you, engaging with all these NGOs, and we're excited to keep growing. Next slide. All right, so I'm going to turn it over to Katie, who will give a introduction on Rebecca, and we'll go from there.
Awesome. Thank you, Miles. I found that very helpful, and I know all this information, so I hope everyone on the line found it helpful as well. And just a reminder, so I'm going to ask Rebecca some questions here so that you all get to know her. If you have any additional questions, Miles will be monitoring the chat, and then you can always follow up with me, with Brielle, with questions specific to your qualifications, your applications following this session. So welcome, Rebecca. Thank you so much for joining.
Thanks for having me.
Of course. So I'm going to start with a question that, digs into your background a little bit more. Following your training, I know that you did work in Boston and Rwanda. How did that come to happen? How did you make those choices?
Well, first, thank you, Katie. It's such a treat to be here and to see so many familiar names as our attendees. And I think similar to so many of you on the line, I've been always thinking about how do I learn as a clinician and thinking about your career in decades of maintaining your clinical acumen, realizing that you can learn from clinical leaders in diverse settings. And so alongside a whole group of folks, we decided as we were finishing our training in Boston that we knew, unfortunately, our residency program didn't expose us to all of disease, all the manifestations of disease. And we, in a sense, needed to be exposed to decision-making in many different settings. So I had an incredible opportunity to spend a month of my clinical time in Rwanda every year for the first 8 years of my clinical practice. And it enabled me to really learn alongside clinical leaders who were facing chronic disease in a way that I wasn't being exposed in Boston. It also reminded me that the tools that I'm using in Boston at one of the Harvard teaching hospitals were as applicable in Rwanda as they were in the halls of a teaching hospital in Boston. And that's because the clinical curiosity of, gosh, I'm not sure what this is. I'm a hospitalist. But if I start looking up with the right digital tool, I can improve my clinical accuracy, my diagnostic acumen, and to be honest, my clinical confidence by the end of the day. And this is all team-based clinical care. So I would be rounding with our Rwandan clinicians, several of whom I think are with us today, and I'd be using the same tools as I was, and I saw people realize, oh, I'm going to expand my differential diagnosis. And it was bilateral in so many ways. So I brought back photographs and screenshots of us using these tools in line with patient care. And then went back to those folks, the publishers who are creating those tools, to make sure that there'd be free access and free subscription for many of you on the line, and eager to help those of you who need access to gain access to these tools.
Cool. Thank you so much. Yeah, that seems like a hugely instructive part of your training. Can you tell me what you're doing now following that training, both in Boston and then in Rwanda?
Absolutely. I mean, I think, and I first want to thank the whole H1 team, because I actually blind reached out to Ariel on LinkedIn because I was so impressed with what H1 was building. And Ariel, thank you for responding. I was incredibly curious about this incredible data source that H1 had created, the connectivity it was creating. And in many ways, I think all of us are looking for global collaborators. The diseases that we're taking care of cross borders, they cross our training institutions. And I think H1 really is that center node. If you're interested in finding new collaborators, join H1 Connect. So when I blind reached out to Ariel, what I was explaining to him was I've always been on the search for what is the next set of digital tools you need as a clinician, as a public health professional, as a paraprofessional, to improve your clinical confidence. And those tools keep changing and they keep getting better. And then I think about kind of how do we decrease access? So how do we ensure if you are caring for a vulnerable population that we decrease the fees, the barriers to entry, so that you can, in a sense, establish this habit early on in your clinical training. So I'll just add a link. I know there's many better evidence folks on the line with us today, but for those of you who are new, we were offering a free subscription, for example, to a set of tools. One including is called UpToDate. And 92% of American clinicians are using UpToDate every day. So we're offering you a free year subscription. It's a 20-minute application to sign on. And if you're affiliated with a medical school, we have a medical school application process so that you can actually lead the integration of digital tools within your, if you're an alumni of a medical school in Africa, for example, or your teacher or a faculty member, pleased to help as well. So we're on the outlook now for the next set of tools that folks need. And I think especially if you're joining a medical mission, a humanitarian response, we want to make sure you have access on and offline to these tools. You don't need to utilize your data, so you're prepared and ready for the medical opportunities that you'll be engaging in.
Yeah, that's great. I wonder if you could talk us through an example of when you've seen this deployed in an impactful way with some of the people you've worked with through better evidence and the tools you provide via that program.
Sure, that's a great question. I mean, we have probably 100,000 points of testimony. We've been doing this for 15 years, and I know there's people on with us today who probably shared their testimony of how access to digital tools changed their clinical practice. One of the first ones that happened to me in Rwanda that first night on call was I saw end-stage tuberculosis. which I'd never seen. I actually had never studied what it looks like, end-stage tuberculosis, because that's not necessarily a disease that our teaching hospitals are exposed to. And that means tuberculosis reached the spine. And so unfortunately, a young person had presented with spinal pain and paralysis. And we were able to quickly identify this is actually end-stage tuberculosis, and enable this individual to get an MRI and actually reach a neurosurgeon within 48 hours of them entering. But I needed to read alongside my clinical colleagues this card on UpToDate to understand what end-stage tuberculosis looked like, and then start establishing kind of the care delivery value chain for tuberculosis for this individual. We've had folks diagnose, unfortunately, breakouts and new threats, new vitamin deficiencies because of climate change. And I think a remarkable piece of the work was in the midst of the Ebola outbreak in Liberia and Sierra Leone and New Guinea, our beneficiaries, including some of the clinicians I think with us today, were looking at the UpToDate card of Ebola 100 days before the first case was reported to the World Health Organization. So the World Health Organization said, gosh, your concerns as a clinician are a vital source of data for us to plan and prepare for future threats. So that's why we're so eager, and I'm so eager to work with our H1 Connect colleagues, because we want you to have the tools, the pedagogy, and the clinical confidence to say, hey, I am concerned about this, and I need more information about it. And I want to kind of raise my hand that this needs further investigation. And in the midst of humanitarian response, as you can imagine, there's cholera outbreaks, there's hepatitis outbreaks. So we know we'll need your expertise longitudinally to manage the considerable threats in these settings.
Yeah, no, that's so interesting. I think when I think of humanitarian work, generally high level, I think, oh, someone is going and giving of themselves and doing good, which is certainly the case. But I think that the value in a network like this, and what you've pointed out, is that, working in diverse settings and working cross-functionally, cross-border, it makes you a stronger clinician yourself. We have a lot of people within our network who are in Africa and the Middle East specifically. I know you've done a lot of work there, obviously in Rwanda and in other facets of your global health work. What advice do you have for these healthcare professionals to develop as clinicians?
That's a great question. I mean, I think it's similar to honestly, any of our career arcs. It's actually spending time reading in line with the problem. So what we know is when you leave a patient encounter, you have 5 unanswered questions. Even the most senior clinician with subspecialty training and so what's been proven in medical education and medical training is to then immediately go look up, what did I not know about this patient's presentation? And that's actually why I think these tools are so powerful, because you can say, gosh, I have a patient presenting with X and Y, Z symptoms, and then start reading through, how do I understand the context of this disease, this pathophysiology with this patient in front of me? And that is what is sticky. And, I think what we remind folks is that this needs to be a continuous practice in the US and in some countries that are represented on the line. You can also be accredited while you're doing the reading. You can answer a specific question at the end of the reading text, and then start developing a profile of continuing medical education credits. And I would recommend, even if your professional association's not on the list, start accumulating the credits, because what I'm watching is that these publishers are working incredibly hard to meet every single professional association. So for example, as you start developing the credits, they'll convert over in your lifetime into credits that your country's professional association of surgeons or anesthesiologists or family medicine will verify. And then you'll have hundreds and hundreds of these credits that actually are perceived as valuable, not only in your setting, but globally.
Yeah. That leads me very well to my next question regarding CVs specifically, and how to highlight and surface these extra credits that you're completing or trainings outside of your medical school or clinical training. How do you see people highlighting that successfully? And what advice do you have to this group as they put together CVs within their clinical spaces?
That's a great question. I know this is not standardized for folks. So in each country, degrees look different. Many folks on the line, their medical degree, for example, is an undergraduate degree. So people have spent 5 years from 18 to 23 or 19 to 24, working so hard to develop their degrees. What I do see, which I think is incredibly powerful, is for people to start reporting out, here's the number of patients I see a year, almost thinking about your patient volume as an attribute. Here are the number of procedures I do, if it's a thoracentesis or a paracentesis, or you're putting in central lines. Actually, calculate that. And some folks kind of create kind of almost like their own back-end Excel spreadsheet. And then, embrace, I would say, the online learning that is available. So much of it now is at very low cost or almost free, that is being recognized. So there's just terrific courses that we're going to post on H1 Connect that we've had alumni complete the courses, the online courses that we're going to recommend. And then you can kind of build that as a section of, here's my continuing medical education, or here's my continuing professional credits that I've taken the course on X and I received Y nomination. We also see people verify that and post that they completed the course, and they'll get a PDF of a certificate of completion as an attachment.
Yeah, and I know that's part of our goal here at H1 Connect, is to give people, the opportunity to highlight that which, they have completed online, and those additional education opportunities they've taken advantage of. Specific to those people, and I believe a large contingent of the people on the line would fall into this category, who are interested in global health leadership and these volunteer opportunities specifically, as either an add-on or an eventual full-time job focus. What advice do you have for them? What are ways to participate or make yourself stand out as a candidate in that context?
That's a great question. I mean, first, I think this is why this is such a unique use case that H1 Connect is taking on. It is very hard to understand, how do I join a roster? So I think some of what we're building with H1 Connect will help people display, here's the number of patients that I see per year. Here's, in a sense, what my medical education process was. And I think it's great to be able to say, and this is the type of clinical practice I want to have in the next 3 to 5 years. I'm building towards that and preparing myself for that. And I'm looking for subspecialty training in the following dimensions of clinical care. So I think part of that's just envisioning, what is your career arc going to look like over time? And I think of planning it in decades, not in a yearly fashion, but what do I want my clinical career to look like, which may include, for example, research, capacity building, training. How do I get exposed to, for example, what it looks like to run a clinical trial in my setting? And there's just terrific online courses to prepare you for that. What does it look like to introduce a new diagnostic or a new drug, for example, in my setting? How can I participate in the rolling out of something that could have just tremendous health gains and health benefits for the population that I'm serving, but requires an introduction, may require, in a sense, almost a new set of care activities to add the capacity to the drugs and diagnostics being offered today. So in my own career, I've definitely followed like one drug and one diagnostic continuously, and I try and learn everything about it. How the diagnostic was built, for example, how it went through its approval process, how you procure it, and then how does it actually alter our clinical algorithms, and similar with the new drugs. So I highly recommend just getting very specific, gain that expertise in your own reading, educating yourself, writing about it, and then finding future opportunities to almost, in a sense, be the individual who's introducing it in your setting.
Yeah, that's great. And I know to piggyback off this, Miles touched on this previously, but in terms of global health work and humanitarian aid, it seems, and you just identified like capacity building and health promotion as one wing of that, that is different from, say, an emergency response, like deploying to a Gaza, for instance. Can you speak more to the differences there, and what that work looks like?
Absolutely. And I mean, I know we have attendees on the line who are subspecialists in infectious disease, anesthesia, surgery, pediatrics. And so, most of us are trained in a relatively narrow band of where our clinical training begins and ends. And it's needed at different time points. So you're right. There's emergency moments where we need the trauma surgeons, we need the orthopedic surgeons, we need the burn specialists to be of help. And then, as we know, the health systems, unfortunately, are going to have a burden of chronic diseases to manage the diseases, unfortunately, affected by drought, famine, war, burns, etc., that will require PM&R docs, physical medicine and rehabilitation docs, for example, strokes, malnutrition. So I think in many ways, what's striking about the NGOs that H1 has been able to recruit is that the medical missions change as what's happening on the ground changes. And then they're going to need functionally a different ready reserve of different subspecialties over time. So I would say everyone on this line is going to be needed at one point in your career. And what we're trying to do is help integrate and help you prepare, schedule that in, be ready and prepared. As you know, what's happening on the ground is ever changing. We know there's new threats coming. And I think we're all so aware with respect to climate change and rising tides that what we're going to unfortunately be seeing is new nutritional deficiencies, drought, famine, where there's just going to need to be a surplus of healthcare providers deployed over time.
Perfect. Okay. I know we have people who are eager to ask you and the team questions, so I'll ask you just one more, and then I'll throw it over to those people on the line with questions. But I know you talked about, planning a career out in decades. So I'm going to extrapolate that to H1 Connect. What, from the clinical side, as a medical professional, do you see H1 Connect doing and becoming over that 10-year period?
That is I mean, I am thrilled to collaborate with H1 Connect. This has been, honestly, Miles, Katie, Ariel, this has been terrific collaborating with you all, because I think the intention here is really to be, in many ways, the virtual accompaniment in your career. We're going to be on the lookout for you of new opportunities, new trainings, new ways you could partner. And so when you're planning and thinking through, gosh, these are the types of opportunities I'm looking for, there'll be a space on your profile to say, this is what I'd like to connect with. And then that helps us aggregate that and kind of work super hard and scurry around to our partners and the people that we've been collaborating with for the last 15, 20 years to say, gosh, we have so much potential talent here. Let's figure out how to, in this sense, shape it in a way that you could, for example, provide that for 3 weeks of a year, schedule that in advance, that your clinical training is accepted, for example, in these additional settings. So we're eager to be those bridge builders for you, and we want to hear what you want to build in your career path. I have to say, alongside the slide that Miles put up, I've probably hit on many of those different boxes across my career. And I think it's added just tremendous dimensions to how I think about my role as a clinical leader, how I understand how drugs are developed, how I understand how they're integrated within new care delivery cycles. And it's just tremendously stimulating to be in a global environment with global professionals. And we're just eager to help you create those opportunities ahead.
Thank you, Rebecca. What a lovely summary. And that's just exciting to think about the next 10 years of what this could be. All right. So Miles, I know you have been monitoring the chat. Are there any specific or thematic questions for Rebecca or anyone else on the H1 team?
Yeah, one interesting one. I responded to Rebecca, but I'd be curious to hear your response. There are people on here that, they're full-time clinicians or they're academics, and they just can't deploy like on a whim, right? But they would like to do some sort of volunteering on their academic break or something like that. What would you recommend for healthcare professionals on the line who, just don't have as much time, and who knows if they'll be called from a ready reserve roster during their time period? Is there something they can do, like to volunteer when they know they're free and kind of schedule it out in advance?
Mm-hmm. That's a great question, Miles. And I think, we'll eager to build this out in your H1 profile. Here is when I am available with this expertise, because it helps us in that matchmaking part. The second I have to say is I think there's just a tremendous need to review, for example, the digital tools coming out. So we are going to be forging for every AI-based clinical decision support tool, for example, patient-facing tool. We need people to review. Does this tool make sense in your setting? When it's translated into a different language, for example, is the language good enough to provide that as well? So I think the idea, in the same way that we review each other's papers in academia, and when you submit a paper, you suggest here are 3 reviewers, think of yourselves as clinical reviewers of the tools needed, both in the humanitarian setting and volunteer settings, but actually in clinical practice, because I think you're going to see there's a huge surge of tools in prototype phase that need your review, need your input to improve. I'll just share a quick anecdote that was when the first couple of years when we were deploying better evidence and bringing these tools, for example, to clinical training in Rwanda, we actually reviewed, there were holes in, it was not as comprehensive as the team had thought. So we did an audit of the parasitology section, and we found over 200 omissions that needed to get fixed. That was ideal for the company. That was high value to say, gosh, these diseases were not well covered. And it was being, in a sense, audited by a group of clinicians who are seeing parasitic diseases every day versus someone who had been studying it right in an MD PhD program. So also to acknowledge you all have tremendous expertise because of what types of diseases, unfortunately, you're seeing, the chronicity of disease that you're seeing, the differences in what is on your shelf, what does essential meds mean in your country, what do you have available, and the ingenuity and the agility of your practice every day.
Great.
Is there any? Oh, sorry, Miles, cut you off.
Yeah, let's take John's question. I think that's a pretty good one. And I'm happy to help with that, Rebecca. But John asks, he says, I'm an ER doctor. He feels well prepared as part of his training in family medicine, but he understands that each mission has unique needs. What type of preparation is available for specific programs? And I'll start, Rebecca, and then if you can add on, that'd be great. So what I'd say to that, John, is the reserve rosters you join, they're going to have specific training for you. Like, for example, Team Rubicon. Team Rubicon is really big on doing missions and deployments into austere environments where you need to be physically fit. You need to, know how to treat patients in an austere environment. And they have a whole training program around doing just that. Save the Children, for example, they're probably going to focus a little bit more on pediatrics and children, right? So they're going to have specific training opportunities focus on that. And they hold, similar to what we do at H1, holding monthly webinars. Most of these NGOs with their rosters, they hold monthly webinars with training as well. So what I recommend to you to prepare yourself is to join as many of these rosters as you can, engage with these NGOs and get their unique specific training opportunities. And that should help prepare you. In addition to that, Katie regularly posts different courses that are free to sign up and complete. These courses were recommended to us by Rebecca or the Harvard Humanitarian Initiative, and some of them from specific NGOs, like Save the Children had a course that they recommend everyone take. So we'll continually update that and share more resources. But yeah, that's my piece. Rebecca, anything to add to that?
Thanks, Miles. I mean, we'll add, longitudinal courses if you're interested in engaging that we run, for example, Global Health Delivery Intensive, the Harvard Humanitarian Initiative, and our other colleagues. If you have the time and space to kind of add a bit of additional time, many of these are actually online as well. And I think just as a family medicine doc, I would also recommend recording how many procedures you're doing. You have such a vast practice. And what it means to be a family medicine physician in your setting is actually different than what the restrictions on a family medicine doc in the US. So that's a terrific example of you are running hospitals, you're running surgical sites, many family medicine docs are doing C-sections, for example. Like, record every procedure that you're doing, tally that up, and add that to your H1 Connect profile.
Great. And then I'll take the next one as well. So Oliver asked, I'm a general surgeon from Zambia. what measures does H1 put in place to protect healthcare workers volunteering in Gaza, especially the fact that everyone's a target there? Uh, so, Oliver, you're absolutely right. Gaza is super dangerous right now. And honestly, the first thing I'll say is that you really are going at your own risk. This isn't for everybody. It's a conflict zone, and we're trying to, at H1, expand outside of just conflict. So you can do development work, capacity planning, training, and all that. But conflict response is not for everyone. You know, speaking for myself, I'm an Army veteran, and I've deployed with the Army to war zones like Somalia in the past, and you really are going at your own risk. So H1 is not responsible for anything that happens with what can happen in deployment to Gaza. But I will say that you're not deploying with H1, right? H1 is a connector, we're a platform. You would deploy with the NGO. When you join these NGOs, many of them have insurance plans in place. So you would essentially become an employee of like Save the Children IMC, and they would have an insurance policy to protect you there. They also will have security deployed with them. So, you know, you're going to be with an armed security guard. There's going to be security measures in place. So really the NGO is owning the liability and security there. They're responsible for doing the best they can to keep you safe. But as I mentioned, you're going at your own risk. It's not for everybody. And we're trying to find additional opportunities outside of just conflict response. If anybody's having issues with the WhatsApp group, we've seen a few people mention that. Just reach out to volunteer@h1.co. Katie, if you can put that email in the chat, we can try to help you guys out with that.
Miles, I just want to add on that, you know, if we think longitudinally, the rebuilding phase of health systems is going to require so many of your expertise. So I think we all see the acuity of the moment in the midst of a conflict. We also know we're going to need tremendous human resource capacity in healthcare to help rebuild these health systems. And as collaborators, we've been on the line with our colleagues in Israel and Gaza. Everyone's under such strain. So I would, in the sense of that area is of interest to you, hold on, because there's going to be a surge of attention and resources and reinvestment to rebuild the health system. And the clinicians are going to need you to help and bolster and give them a respite as well. So I think you're going to start seeing more rotational patterns as such. And we know, to be honest, that, you know, many of the islands in the world are very concerned about what they're going to be facing. We have very isolated professionals. Unfortunately, on some of the islands in Indonesia, for example, islands in the middle of the Pacific, that there's going to be a call to help almost give people a sense of, gosh, can I have a 3-week respite because I'm the only provider on Papua New Guinea? Can someone substitute in for me? So we're just in the early phases, but that is going to be part of the functional offering as you build your profile. And then obviously that helps you kind of future connect. So thank you for those who are interested, and also thinking through our isolated providers who aren't with us, aren't joining us today, because they might be the only clinician in their setting. We are eager to help create respites for them over time with your expertise, and just grateful for your engagement and thinking through those who couldn't join us today because of the burdens they face.
Great. All right, so we've got 8 more minutes. Let's take a few live questions. So, Lamine, you are raising your hand. I'm going to allow you to speak. You want to unmute yourself and ask your questions.
All right, thank you. I just want to thank H1 for this webinar. I think it's a great opportunity to learn about what you're doing. I think it's a great thing, sort of connecting between NGOs and those of us who want to volunteer. So just introducing myself, I'm Lamine. I'm from the Gambia, West Africa. I'm a general surgeon. I just have one question, but prior to that, I also want to say that Dr. Rebecca, you're doing a great job, because I've actually been a beneficiary of the better evidence up to date for the last 6 years. I practically use it every single day and has made a huge difference in my practice. So thank you for that. So I'm a clinician, but I also do a lot of research work. So basically, the question I want to ask is, you did mention H1 sort of like provides a link between pharma and, you know, those who sort of want to do research in Africa and maybe some other countries. I just wanted to know, since it's a mutually beneficial relationship, whether they probably would be grant opportunities for those who want to do research maybe on a particular topic within their setting, because most of us are clinicians, but we're also a lot into academics and research as well, and probably have some sort of guidance when it comes to grant writing or maybe sourcing funds for certain research projects that we think that are relevant to our setting. So basically, that's the question, and great joining in, and thank you for all that you do.
Yeah, thanks, Lamine.
Yeah, Lamine, great to meet you. What a treat. I'm really, it's just really an honor. And I just have to say that is an exact request that we'd love to have on your H1 Connect profile, where then we can offer office hours, connectivity. I sat on the Novartis Foundation board for several years, and they exactly want to hear from clinicians. What's the type of research you want to conduct in your setting? There may not be a clinical trial site. You have an interest, you raise your hand. Here's what you're concerned about. So that is such a helpful use case because it helps us build that within your profile and then aggregate that data and then start being able to kind of present that to our pharma partners. So eager to hear what's the research question you have and kind of what the resources you would need as such. And in the global surgery community, also, we're kind of well connected to that node and how others have funded their research. So eager to help. And I'm just, thank you. That is a spot on use case for how we should build out your profile.
Yeah, and let me give a little more context on H1's work with pharma, Lamine, for the whole group here, because I know I kind of glazed over that. So tactically, what H1 does and really how H1 makes money and how we're able to do all this for you for free is we have a platform that looks a lot like a LinkedIn. Think of it like a Facebook of doctors or a LinkedIn of doctors, where it's data that we've aggregated on doctors, and we sell pharma companies a subscription to that platform for them to find doctors for clinical trials. And we really focus on helping pharma companies find diverse doctors for clinical trials. So maybe a highly qualified doctor like yourself who hasn't actually engaged with that pharma company for a clinical trial before, but they have experience in this unique indication, this therapeutic area, and they're really interested in doing the work. And they might be serving a diverse group of patients that we want to make sure are enrolled in that clinical trial. So that's like what H1 is actually doing on a day-to-day basis. We're connecting pharma companies with doctors and sites, hospitals for clinical trials. And with that, we maintain relationships with essentially every large pharmaceutical company there is. You can think of Novartis, AbbVie, Amgen, all of them are on our platform finding doctors for clinical trials. And what we want to start doing is this network that we built here on H1 Connect, with mainly around humanitarian response. We want to start having this network engage with pharma as well, because pharma wants to work with African doctors from West Africa like yourself, but they don't really have the channels or the means to find those doctors today. And they're also, in many of these countries, as you know, the research infrastructure is not yet fully established yet. So how you would probably engage with doctors today is like, as Rebecca mentioned, the Novartis Foundation, for example, or each of these pharmaceutical companies have a global health impact arm. And those are the groups that we're looking to talk to about like starting to explore expanding clinical trials and research outside of just the United States and Europe and into Africa and the Middle East. Because like we said, H1's mission, we're trying to build global health equity and expand global health equity. And I think part of that is expanding clinical trials and research to areas that don't typically see it, such as Africa and the Middle East. So that's like further vision for H1, further future that we're working on. We're hoping to have updates for that in the next few months or so.
Miles, I also just wanted to add that this is beyond kind of the new drug, but the new diagnostic. So I think of FIND, which is a very large NGO based on new diagnostics that come to bear. There's so much interconnectivity to our work. So you explaining this is the surgical diagnostic or device that I need in my setting, it needs to look like this. Putting out that use case helps us kind of attract the talent, maybe the engineering talent or the diagnostic company, or match you with kind of the therapeutic company that has an early trial.
Great. Okay, so we're pretty much out of time here. I know we've got a few more people raising their hand, but thanks everyone for joining. If you have any additional questions, reach out to us on WhatsApp. There's an H1 WhatsApp. You can reach out to that at any time and we will get back to you right away. I'm going to post here the links one more time. So if you're not already a member of H1, click that top link, sign up for H1 right away. If you've already signed up, you can sign in at that second link where it says sign in. Make sure you complete your H1 profile so we can get all the information we need. And then if you're not already, join the WhatsApp group at the bottom. You can, anytime you have a question, you can reach out to us via email at volunteer@h1.co. I just put that in the channel. Or you can join the WhatsApp group and you can message our H1 WhatsApp account at any time. And we have multiple people monitoring it that could answer those questions for you. So thanks everyone for joining. And we will be back next month with these monthly webinars and we'll bring on somebody else. Rebecca, I hope you join again, but we'll have somebody else in the hot seat for the interview. So thanks a lot, everyone.
Thank you all. And thank you, Miles and Rebecca.
Thank you everyone for joining.
Thank you.